So good morning and welcome to the National Hispanic Council on Aging, or also known as NHCOA's webinar on how to successfully work and engage with Hispanic and Latino Americans. I'm Christine Perez Jimenez, NHCOA's Director of Programs, and it's my pleasure to moderate today's virtual event, which is supported by the Administration of Community Living, also known as ACL. We would like to take a moment to share a powerful way people across the country are joining us in our mission to improve the lives of older adults, their families, and caregivers through our individual membership program. For just $25 a year, members gain access to exclusive resources, educational workshops, advocacy toolkits, and bilingual information on health and aging. More importantly, by becoming a member, they are helping sustain our mission and the programs that uplift and empower our community. And you can be part of it. So you can simply scan the QR code that it's in this right slide and just to learn more and join our membership program today. So just to get started, Hispanic and Latino Americans are a vibrant and active part of the United States that continues to grow, and working effectively with this community requires cultural understanding, trust, and inclusive approaches to ensure meaningful and effective results. So in today's webinar, we will explore the importance of culture and language when engaging with Hispanic and Latino Americans, and also identifying strategies that make use of such cultural and linguistic awareness. So to begin, it's my pleasure to introduce Dr. Janira Cruz, the President and CEO of the National Hispanic Council on Aging, and also one of the nation's foremost advocates and spokespersons for diverse older adults. Welcome, Dr. Cruz.
Thank you, Christine. Thank you so much for that very nice and kind introduction. And good morning to everyone. I am delighted to be here with the rest of my colleagues who are joining me as panelists for this very important and informative webinar. So thank you all. You know, Multiculturalism is a hugely important aspect of our country. The diversity present in the United States is a national treasure, and it is absolutely an asset to our success, to our progress, and prosperity as a nation. I remember growing up in Washington, D.C., and I found such joy in the many different cultures that surrounded me. And I was thrilled to learn about all the different sorts of languages and people that came with each culture. And when I was in college in Boston, I participated in the International Club. I loved tasting all the different foods I had never tried before and having the opportunity to experience each culture's own unique traditions. Multiculturalism is a quality that always has been a staple of American culture, a point of admiration and pride. In the same way that we have a global economy, that we can enjoy mangoes without actually growing them in our backyard, we also have people from around the globe united in one country. And understanding our diversity is not something that should divide, but something that should unite. The more we know about each other's culture, the more we can grow together as a society. And at one point, this felt understood on a national level. Long ago, in 1956, President Dwight Eisenhower created the People to People program. People to People was part of his effort to promote international understanding and peace through direct person to person contact. encouraging exchanges in education, culture, and professional fields. The initiative was first announced at a White House conference attended by leaders from various sectors, and it later evolved into exchange programs for students, professionals, and community leaders. We need more programs and initiatives that follow this perspective, wherein we reach across divides to understand those different from us so that we may grow together. It's that perspective that has brought us here today for this important webinar. And so Hispanic Americans are one of the fastest growing and most influential communities in the United States, with a population of a little over 50 million people. Far from being a monolithic group, Hispanic Americans include a wide range of national origins, languages, traditions, and experiences, each adding a unique strength to their communities. Each community responds more effectively to different approaches. For example, what works among Puerto Ricans is often different than what will work in heavily populated Cuban communities or Mexican American communities. And so to be effective, it's important to understand these differences and nuances. And understanding how to work with Hispanic and Latino Americans is essential to serving a significant portion of our nation. And as the National Hispanic Council on Aging, it is paramount that we consider the vulnerable intersection that comes with being an older adult within an underserved community. And with that in mind, consider that every 7 seconds today and for the next 20 years, someone in America will turn 60. The number of Hispanic and Latino American older adults is also expected to grow rapidly over the coming decades. And they deserve the opportunities and services necessary for any older adult to live with dignity and good health. And so today, we will hear from experts about key strategies to working effectively with Hispanic Latino Americans. We hope you can learn and engage in this important topic. But before ending, I would like to take a moment to thank my fellow colleagues who are here with us today. I have great admiration for them. They've worked in this area for many, many years and bring with them a wealth of experience. And I also, of course, before ending, want to acknowledge and thank ACL, the Administration for Community Living, for supporting our work and being part of this effort. Thank you. Muchas gracias. Christine.
Thank you, Dr. Cruz, for your remarks. So let's start with our panel session. So every community has specific needs, including preferences around how they are communicated with or engaged by outside entities. Through community health workers, or also known as promotoras de salud in Spanish, are trusted messengers in the Hispanic and Latino communities. Promotoras are community leaders that know who to reach, where to reach them, and how to engage with them. So let's present our first speaker, which is Betsy Rodriguez. Ms. Rodriguez has over 25 years of professional experience as a nurse, diabetes educator, author, and bicultural specialist in health communication strategies focused on Hispanic and Latino, African American, and American Indian communities. She retired in 2025 as a senior public health advisor at the CDC's Division of Diabetes after more than 2 decades of service. So today, Ms. Rodriguez will highlight the importance of promotoras de salud and engaging Hispanics with health-related information and resources. Welcome, Ms. Rodriguez.
Thank you very much, Christine, and thank you to Yanira and to the National Hispanic Council of Aging for extending the invitation to be here with you all to talk about something that really is so close to my heart. And let me start by sharing with you a very short and sweet story about why community health workers are so important and speak so much to my heart. Few years ago, my daughter, who has been living with diabetes for over 42 years, she lost her health insurance. So will you imagine a type 1 person without insulin or the supplies for her pump and her continuous glucose monitoring? I was desperate. I tried to buy on myself, but if 3 months supply was around $3,000. Who can afford that? So, well, it was a promotora from here, from Georgia, who actually helped me find a program for her. And then after that, a new health insurance. And she was hand-holding my daughter through the whole process. Me, with all the credentials after my name, I wasn't able to do that. It was a promotora who actually helped my daughter and helped my family. So that's why I know they are effective and they are cost effective. So this presentation today will focus on the vital role of promotores de la salud engaging Hispanic or Latino communities. And notice that I say or Latino communities and no backslash or anything like that, because we're so different. And so promotores de la salud are community health workers who play a crucial role in bridging cultural and linguistic gaps to improve health outcomes in these communities. Next slide, please. The agenda outlines a comprehensive exploration of promotores de la salud, starting with the community role and moving through understanding health disparities, promoting positive health outcomes, and building trust. It also covers training, evidence support their group, and strategies for engaging and collaborating, concluding with opportunities to advance community health. So next slide, please. So welcome everyone. Today we will delve into the significant contribution of promotores de la salud within Hispanic and Latino communities. And our goal is to appreciate their impact and explore effective ways to engage this trusted workforce to enhance health outcomes and reduce disparities. Next slide. But who they are? Who are promotoras de la salud, community health workers, community health representatives, as they are known in the American Indian community? Promotores de la salud are community health workers who come from the very communities they serve. They share culture, they share the language, they share life experiences, making them trusted figures who effectively connect with community members, with healthcare system, acting as essential bridges between to improve access and understanding. They're vital in engaging community health workers with health information by serving and trusted liaisons and leveraging the cultural understanding to address health disparities and provide crucial support. Next slide. So, promotores de la salud matter because they are trusted insiders who share language of the culture within the Hispanic-speaking communities especially. They provide culturally relevant health education. They connect peers to vital health and social services. And they help overcome barriers like language and trust, especially around the environment that we are right now. Trust is a vital aspect to engage Hispanic or Latinos in any given effort, program, or initiative. Their work supports disease prevention, chronic disease management, health equity, and reduce stigma around sensitive issues, making healthcare more accessible but also more effective. Next slide, please. So, promotores play a key role in reducing disparities among Hispanic or Latino communities, which we are the fastest growing underrepresented group in the United States. They serve as trusted liaison between patients and providers, delivering sustainable health impact by engaging directly with underserved, low-income Spanish-speaking populations. They help overcome barriers such as language, literacy, poverty, and mistrust, which often prevent access to care. We know that many of these issues that I'm talking about right now are very common in many Hispanic or Latino communities, and promotoras are there. Now that we're having this webinar, they are out there in the community, serving our people, serving our familia, serving our gente. Next slide, please. The slide highlights strategies promotores use to promote positive health outcomes. They improve healthcare access. They teach healthy habits to reduce chronic disease risk, for example, in hypertension and in diabetes, and then provide education in Spanish. They encourage preventive care. They promote nutritious cultural recipes. They support active lifestyles. Right now, Visión y Compromiso, for example, has had for many years these salsa dancing classes that are out there in the community, helping our communities to be more active. And there are many other organizations who are doing this as we speak. They connect individuals to resources. They address mental health and tackle sensitive issues, all while building trust through crucial understanding. And as you see in here is a briefly nice summary of the core competencies for community health workers identified in the workforce study conducted by a group of interested professionals coming from HRSA to identify core competencies, roles, and skills of community health workers. So we need to stop asking who they are and what they do, because the science and the evidence is out there. Next slide, please. So promotores assist families in applying for health insurance, addressing high uninsured rates, and support open enrollment with consistent follow-up. They conduct outreach in trusted community settings such as churches, schools, and door-to-door visits. Their messaging is culturally and linguistically appropriate, using empowerment-based education to foster active community participation and reflection, ensuring that health information reaches those with limited transportation or access. Next slide, please. But then on the other hand, training and supervision is very important. So effective training and supervision are critical to promotores to deliver impactful health programs. Training must be interactive, culturally relevant, and community-centered, with ongoing supervision to maintain the quality. For example, a 30 hours diabetes prevention training improves promotora skills in recruitment, in group facilitation, and in behavior change support, resulting in what? In high satisfaction and increased knowledge. Next slide, please. Systematic reviews from the community guide show that CHW-led interventions significantly improve health outcomes in Latino populations. For obesity and diabetes prevention, they reduce A1C levels and weight, helping prevent type 2 diabetes. For heart diseases and stroke, community health workers effectively lower blood pressure and cholesterol, promoting healthy behaviors. And these interventions are not only effective, but are also cost-effective, contributing to health equity. I have the privilege to be part of the group who work with the community guide to identify and conduct the systemic reviews, proving the effectiveness of community health workers in diabetes management, in type 2 diabetes prevention, in cardiovascular diseases, and in the next one that I'm about to tell you. Next slide, please. So CHW's outreach has increased cervical cancer screening rates in underserved communities, especially when combining education with access. Promotores engage people beyond healthcare settings, in homes, in schools, in churches, making them ideal for reaching low-income Spanish-speaking groups. Their cultural and linguistic competence build trust, overcome stigma, and addresses literacy behaviors and barriers, enhancing engagement and health outcome. Next slide. So building trust of su promotores involves shared identity and cultural understanding as they become from the same communities and communicate openly as equals. Consistent, empathetic engagement includes regular community presence and co-creating culturally essential health educations. They bridge families to health and social resources. They assist with applications. They increase care participation. They empower communities by prioritizing their needs and fostering autonomy and confidence. Next slide, please. So, to effectively engage and support promotores, it's essential to include them in care teams and program planning, providing comprehensive training and fair compensation, recognizing their value contributions, uplifting their role in outreach and care delivery, and ensure they are respected partners in improving community health. They even have a mantra that says, nothing about us without us. So when you are engaging community health workers, engage them then in the true essence of making them part of the whole planning from the beginning to the end. Next slide, please. Here I am showing one of the latest resources that I developed when I was in CDC in the Division of Diabetes Translation. It's called the Road to Health Toolkit. It's a toolkit for community health workers to increase awareness at the community level that type 2 diabetes can be prevented or delayed. So as you can see, it have all kind of resources from activity guide, group leader guide, user guide, evaluation guide, participant guide. But what has made this resource so important and so well adopted? Because we included community health workers from the beginning to the end. Every single part, every single word, every single strategy that is here was addressing what we heard from community health workers in the focus group and in the formative research that they were part of it to develop this useful resource. And I leaving you the link so you can access it. It's available in English and in Spanish. Next slide. So opportunities for collaboration, there are way too many. Collaboration opportunities include partner with local CHW networks and community-based organizations, such as the National Association of Community Health Workers, when I am a board member, and co-creating culturally tailored health materials to ensure that it's relevant, that it's effective, and it's that truly is going to reach the communities, in this case, the Hispanic or Latino communities. Investing in sustainability of CHW program is crucial to maintain and expand their positive impact in community health. So next slide, which I believe is my last one. So promotores de la salud, therefore, are indispensable in fostering healthier Hispanic and Latino communities. Recognizing, investing in, and amplifying the role with healthcare system is vital. They proved that when we were all hit by COVID, they still there doing their work. Together, these efforts can significantly reduce health disparities and improve the quality of life for those populations. So next slide, please. Thank you for your attention. I welcome any questions or comments you may have. For further information and to continue this important work together, please feel free to contact me, as I provided there my email. So let's stay connected, keep and advancing community health. And my last slide, Christina, I promise this will be my last one. These quotes underscore that authentic connection in community health requires respect, requires representation, requires collaboration. Promotores are highlighted as essential partners in creating lasting impact, in reflecting their critical role in fostering trust and effective health information within community. So they can create those authentic connections that we all need in order to reach our people. Our gente. Gracias.
Thank you, Betsy, for this wonderful presentation. And again, for any of you who may have any questions regarding Ms. Rodriguez's presentation, we will have a question and answer session at the end of this panel session. So please feel free to write your questions in the chat box, and we will review them in the question and answer session that will be in a few minutes. So let's continue with our next presentation, and it's more about outreach in rural areas is essential to ensuring that all Latino communities can receive the information, services, and support they need. Rural Latino communities often face geographic isolation, limited access to resources, and language barriers that prevent them from receiving adequate support. So our next speaker is Dr. Baraison. He's a community partner at the National Hispanic Council on Aging and also the executive director of the Age Perfil Latino TV Inc., a media production nonprofit organization that produces multicultural, bilingual television programs aimed at informing and educating Hispanic families on available programs and services. So today, Dr. Paraison will speak about effective ways to achieve successful outreach in rural populations. Welcome, Dr. Paraison.
Thank you very much, Christine. And again, I want to say hello to all and congratulate all the panelists that are participating in this important webinar today. Also saying a good shout out to Dr. Janira Cruz. We've been participating with the National Hispanic Council on Aging for many, many years back. So again, it's my pleasure to be with you today. And then for those who are attending the webinar, so I hope you can get some good tips so you can apply in your daily activity as promotores de salud or whatever you're doing in the health sectors. I'm going to be talking about how to successfully engage and work with Latino, especially in rural community. We're talking about rural population, but I'm going to focus, although I give some ideas on strategy to reach the population in those areas, but I'm going to be really talking about an initiative to reach younger Latinos. I believe younger Latinos are key to get to spread the message and to also coordinate with their family, looking for their seniors, for their abuelitos, abuelitas, mom and dad, to continue getting them integrated. Because for the Hispanic in general, La Familia is very important. So in order for us to generate enthusiasm, probably is a good idea to start with the youth. Next slide, please. Um, I I will give you an overview of really what Perfil Latino does. Perfil Latino, as Christine did in a presentation, thank you for that. We are a nonprofit organization. We are based in South Jersey. So we've been in existence for over 20 years. And it's really our pleasure to be able to serve the community. Over the course of decades, we have recruited about 70 volunteers. But lately, we have dedicated more time to recruit younger volunteers in a special initiative. This is where we find our conclusion to be really effective in bringing younger generation to the table. Perfil Latino was uh, started first to like a community organization. It is continued to be a community organization, but we also develop a television production. We do a television program that is broadcast in the South Jersey area, especially in Cumberland County. We're talking about Millville, Bridgeton, Vineland, and probably part of Atlantic City, part of Philadelphia, and so that's where we broadcast. We usually broadcast on channel 190, and then also in WMCN has also covered a lot of territory for us. So our show goes every Sunday. This is a half an hour show is usually like interview format. We bring speakers, and also we report on community events. Next slide, please. So youth leader, what we've done with them, they really are trained, and they go to small presentation. They go to do small presentation in schools. But I want to emphasize that one leader, Rosita, especially shines and delivers. She's our really youth leader that is reliable, that is also knowledgeable, that can also bring a lot of people into her presentation. Next slide. So the small presentation format that we've been using work well, but the most common issue was that it needed to be brought to the superior to be considered. So when we started doing those presentations in the school, well, we really needed to talk to the principal, to talk to the superintendent to see if that's appropriate for the school. On the other hand, we struggled with the technology because the student laptops blocked any links that were from anyone outside of the school. From this point on, we switched to issue surveys on paper. So while we're doing the presentation in the classroom, for example, and then we get trouble with the technology, so we find out that, well, in addition to that, we also have to do surveys in actual papers. We'll continue in the next slide. So you can see we take a lot of pictures for you to be able to see exactly what we're talking about. So our youth leader, Rosita, she's on the far right. She was instrumental to gather small groups that were best. And by the way, we know Rosita, she has just received the Henry Awards, Outstanding Performer in a Play at the Denver Center for the Performing Arts in Denver, Colorado. She participated in a play that is called I Am Not Your Perfect Mexican Daughter. So that was something that makes us very proud. And that's what's really something that we really say, well, it's a good idea that we have choose her to be one of our most important leaders. She can really show other kids or the youngs on or the young adults what they really need to be doing and to improve their presence in the community, to improve their way of living, to develop um, themselves as a better person. So if you have some time, you can Google Rosita Salvatierra at this Denver, Colorado Center and for the Performing Art, and you see what we're talking about. Next slide, please. So those are the things that we've been doing. We attended multiple sport events to reach them where they are or where they go. We're talking about young adults again. You know, they go to attend any high school games, any football games, and then so Rosita will go there, and then so she will go with a couple of others volunteers, and they're talking and they're uh, discussing with the participants, some of the participants in a small group. Sometimes we can do a quick survey. You see her distributing some survey, and then people are really interested in see what she needed to say. Um, she had this way of engaging people. Next slide. So we mostly go to local parishes also. You know, the church is an important part of our outreach. Some parishes that allow us to circulate surveys and presentation to students during Sunday school. So that was also a good way to engage the community. Next slide. So when we're talking about that, this new initiative to reach out young adults, that's went very well. The enthusiasm of our trained young leaders was remarkable, and she was able to spread the word of our mission to improve, encourage self-help care. So we talk a lot about that. She talks a lot about that, and also with the other volunteers that people have to be really taking good care of themselves and following their doctor's recommendation. Next slide. Uh, we also attended some women's empowerment for young girls. You can see Rosita there, and then when we go to those events, we usually give some little gift or raffle a basket or something. One of these events was a couple of years last April, where we have the largest turnout. About 1,000 children were in attendance. That was really spectacular. At those events, we donated raffle basket and allowed each person to enter in return for taking our survey. Last slide. Next slide, I mean. So 2 years ago, we had a very successful event on March 19. We put on a bilingual fair for the local community with activities and free ice cream. So that was also a successful way to reach out for the community. Over 300 people attended, and then they all have ice cream for free. So ice cream is always a good attraction. Whenever people get ice cream, they're going to eat some ice cream. So if they have some chronic issues, they might have to reduce the size of the ice cream so they don't have a problem with the increasing of their blood sugar. But for one time, I don't think that's make a big difference. Next slide, please. So what we've done for that, we created flyers in both English and Spanish to advertise the event on our social media accounts. We also put up flyers in public buildings so that people would hear about our event. We reached a total of 1,865 people on Facebook. So Facebook social media was a very modern way to reach out for people. We all know that. Next slide. So to encourage young adults to take our surveys, we gave free ice cream to everyone in attendance. We received 97 surveys from every young person who attended the event. As people waited in line for the ice cream, we presented them with health information. Perfil Latino partner, for example, with Jefferson Health, they are located in Philadelphia, and they attended as well, bringing gifts for everyone to enjoy. So we also give free health information brochure, and testing kits were available also to all. So next slide. So this was an approach that we test in our area, getting the youth involved. That was very successful. We saw that already. But I can elaborate in some specific strategy to reach rural population. Number one is to have the organization or any representative of the organization participate in established event to build trust. This is really something that I want to emphasize a little bit more. If you don't have the trust in the rural community or maybe another community in general, if you don't establish that trust, if they don't see you in all their events, don't just show up when you have an event, expecting them to come, but you do not show up at their event. So you have to participate if they have uh, established event, a fair or a community event or something. Even sometimes they have celebration at the senior centers. You have to be present there so they can see you, they can start trusting you. Number two is to connect with local organizations such as government agency also, churches. Churches are very important for you to connect because that's where people go to pray, to participate in masses or services. So if they see you once in a while there, they know your face. Or if you already belong to a parish or to a congregation, if you're already there and you presenting something to them, there is they're going to be more receptive to listen to you and to help you accomplish what you needed to accomplish. So, and then you need to be so. others organizations also, you need to do that to build that partnership. You also need to offer some incentives, such as transportation. I heard Bessie talk a little bit, touch about that. Transportation is important because a lot of those people in the rural community, um, they don't have access to public transportation. Sometimes they don't have public transportation at all, so they have to rely on somebody picking them up, or some community buses, or if they have that, they can give them a ride from one point to another. So if you offer incentive, um, such as transportation, some places they use Uber or they use other modern transportation. So some places can have uh, the funding to pay for that a little bit. So that will be very helpful. So they can go and they be transported to and from the event. If you give them some gift card also to participate, that will also help. That also very important for them to complete surveys or to participate at personal development workshop, including helping with iPhone technology. That's very important because sometimes those in the rural population, even though they have cell phones, sometimes they don't know how to use them very well in other populations as well. So it will be very interesting if you can offer them some iPhone technology, and then um, review for them how to send text message, how to respond to that, and so on. And then you also need to empower and train volunteers to implement educational health program. That's very important. So if you have training available for them, they will come, and as they go, as they learn, they can spread the word. They can invite more people to come to your events. So next slide, please. So in conclusion, in addition to the previously named strategies that we were just talking about, using young trained leaders was very effective to work with younger Latinos. The idea was to inform and promote self-help care from the voice of peers and always recommending regular doctor's visit. I think this is the key because if people are healthy, they can do more. If they're not healthy, they're going to be struggling in trying to improve their health, and that can take a long time. But if they know what to do to stay healthy, that's going to be very helpful for the community. It does also apply in the rural population. The rural population also they understand that, and also some of them are a little bit healthier because they don't they they have to walk from one place to another instead of taking a public transportation that they don't have. So with that, I think Christine already gave me the sign that I'm already off my 15 minutes. So it's been a pleasure talking to you. We'll see if you have any question at the end. Thank you.
Thank you so much, Dr. Paraison, for your presentation. So again, as a reminder, we will have a question and answer session following our panel session. So feel free to write your questions in the chat box until then. So
Yeah.
developing effective strategies to engage Latinos living in senior facilities is vital for promoting inclusion, well-being, and quality of life. But let's hear more from our next speaker, who is Pedro Lima, NHCOA's Finance and Project Development Manager. Today, Mr. Lima will highlight strategies on how to engage with Latinos living in senior facilities. Welcome, Pedro.
Thank you, Christine, and good morning, everyone. I'm so happy to be here. So today I'll be talking about the strategies to engage Latinos living in housing in senior facilities. So first, I wanted to introduce myself. I'm Pedro Lima, Finance and Project Development Manager at the National Hispanic Council on Aging, or NHCOA, where I also manage Casa Iris, one of our senior housing facilities in DC. Today, I'll be sharing those strategies that we've developed to engage Latino seniors living in housing facilities based largely on our successful work at Casa Iris. So, why we engage with Latino seniors? So, before getting to how, let's start with why. Latinos are one of the fastest growing older adult populations in the US. That's very well known. So they bring with them very rich cultural traditions, strong family values, and deep sense of community. But they also face unique challenges. Among of them, we can say about the language differences, limited access to culturally tailored services, mobility limitations, and the digital divide, which can create isolation from family and resources. Engagement for us is not just about participation, it's about creating spaces where they feel seen, respected, and included. So at NACOA, next slide please. At NACOA, our guiding principle is cultural inclusion with flexibility. It's important to remember that Latinos are not monolithic, and I think this was already mentioned here today. So it's very important, as Dr. Cruz mentioned, that we came from diverse countries, cultures, and even different languages. So while many or most speak Spanish, countries like Brazil, for example, we speak Portuguese, and some Caribbean nations, such as part of Haiti and Dominican Republic, have French or French Creole influences. In Casairis are residents. They come from many countries. There might be El Salvador, Puerto Rico, Mexico, even other parts of Central and South America, as well as the Caribbean, with each with unique traditions and needs. That's why we avoid one size fits all approach, adapting activities to residents' abilities, comfort levels, and cultural preferences. Our bilingual and culturally aware staff play a big role in building trust and fostering connection. So let me talk a little bit about the housing facilities we have. Next slide, please. So NACOA has Casa Iris and Mira Vista housing facilities. Casa Iris is here in Washington, D.C., and we see it more than just a place to live. It's a model for other facilities nationwide. Many of our programs are developed and tested here before we share them with other organizations and communities. As NACOA also own and operate Mira Vista, a senior housing facility in Garden City, Kansas. While today I will focus on examples from Casa Iris, both facilities reflect NACOA's commitment and culturally inclusive and person-centered engagement. So at Casa Iris, we focus on three main program areas: physical activities adapted to different mobility levels, community garden, encourage outdoor activities and collaboration, and technology classes, bridging the digital divide and connecting residents with loved ones. This aligns with Dr. Parizan was just mentioning about connecting people with iPhones or technologies, and I will talk a little bit more about that. So the next slide. I'll talk about the first strategy, which is the movement and mental wellness in aging. So at Casa Iris, our program is more than just an exercise. It's part of what we call universalization of movement and mind. Movement is fundamental to human life. We are born moving. Movement stays with us until our last breath. Promoting active and healthy aging means helping older adults understand that staying active and physically healthy and mentally is not optional. It's essential for well-being and independence. So usually our approach includes education and awareness so residents understand that physical activities is medicine. Every step, stretch, or dance move counts. And mental health is equally vital. We show how movement and mental wellness improve health, prevent disease, strengthen the immune system, and foster emotional resilience. We adapt our sessions to individual needs with gentle exercise for coordination, balance, muscle strength, and cardiovascular health, while also incorporating mental health tasks tailored to realities of Latino older adults. These sessions use everyday language, practical examples, culture familiar stories, And most important, we respect cultural traditions and daily habits to show how meaningful daily activities can help maintain strong cognitive function. By connecting psychological concepts to their real life experiences, residents usually easily understand and apply tools that support both mental wellness and healthy aging. So when we do this, our goals are physical benefits. The idea is to strengthen muscles, joints, and immune system, and also is a great way to prevent falls. Psychological benefits. There, we aim to reduce anxiety, depression, and stress through movement and accessible mental health guidance. Health benefits that help manage chronic conditions like diabetes, hypertension, and obesity while reinforcing mental resilience. And last but not least, the social benefits. Being dancing, walking, cultural celebrations, and share stories, those things create bonds between the residents. We also take the older adults outside. I think you can see pictures there when we take them outside to parks, open spaces, community areas where we organize walks, picnics, recreational outdoor gatherings. These moments are both socially and mentally enriching, giving residents a change of scenery, practical health, education, and renewed sense of joy. So everything I mentioned to you all is the idea of combining physical activities with culturally adapted mental health conversations. We try to turn every session an opportunity for learning, empowerment, and connection. We use familiar music like salsa, merengue. It all depends on the public who is talking and speaking to. And relatable stories so exercise and reflection become a celebration. Making it fun, accessible, and meaningful helps residents to embrace the movement and mental wellness as part of their identity and everyday life. Not forgetting that mental health it's a stigma in our community, so this has to be very baby steps when we're talking about this, and people feel comfortable enough so they can take into the steps where you're guiding them through. The next slide, please. I'm talking a little bit now about the community garden. Our community garden is a favorite among residents. It's not only a place to grow herbs or vegetables, which is very often familiar to their home countries, but it's also a space for conversation, teamwork, and fresh air. Gardening brings a sense of ownership and pride, and it often sparks storytelling, with residents sharing memories from their youth. So it's very common for us to go and see people at the community garden talking to each other, telling stories about things back in the country. Sometimes when they're born in the United States, talking about back on their states they used to live, and it's enriching conversation for sure. The next slide, um, we're talking about the technology classes, and technology honestly can be a lifeline. So NHCOA's technology classes offer a wide range of competencies to support older adults and caregivers in using technology to access information. We teach the basics of using a device such as a smartphone and tablet, and how to create an email, how to create a password. Also, our classes offer an introduction to artificial intelligence. Of course, classes are offered in Spanish and English, which is very important. And I have a quote from one of the residents who said, I spoke to my granddaughter in El Salvador on video for the first time. I felt like she was right next to me. So that's the power of digital connection. Most important here, when we're trying to, creating these technology classes and thinking about it, we take into consideration classes that already happened, because we are not the first ones doing this. But our difference and engagement we see we saw was because we realized that we had to go back into the very first basic steps. A lot of older adults, for example, they have smartphones, but they only use their smartphones to dial a number, not even using WhatsApp or Facebook. So we thinking about this is like we have to teach the very basics, like creating emails, how to turn on the iPhone or smartphone. Then we move in step forward. So people would feel that they're actually learning something and it would be engaged with us. The next slide, and that was mentioned by the my presenters, both speakers also mentioned that adding fun and incentives. This is another way we encourage you all when engaging with Latino older adults. That's how we've learned that engagement often grows when activities are fun and rewarding. When we go on outdoor trips, for example, the parks, cultural events, and festivals, we try to bring at least water, some snacks, and if we go into a park, we try to bring a speaker to have some music so people could, feel like home. And we try to include quick games, raffles, and dances to keep the energy high and the experience memorable. Next slide. Now I will give some tips for success from our experience, and I will give you all now four of those tips. One, and it was also well said by Dr. Paraison, build trust first. Consistency and familiarity matter. We need to build first, to build trust. Whenever we talking to people, they need to see you as a partner that are there to help. Sometimes they have distrust in some offices, in other organizations or other people, even family members that could be a harm for them in the past. So you need to show them that they can trust you and you are a trustable partner into this community. Also, you need to empower the residents, give them a voice and plan activities. So when you're planning something, just don't just plan because you want that. Ask your community if that's something they also want, if that's something they wanted to be part of. If not, make adjustments to make the most of the community that you're working with. Celebrate culture, music, holidays, food from different Latin America countries. All of that helps when you are engaging with this community. And most important, ask for feedback. Like I mentioned on this tip number two, not just before, after the activity happens, keep involving based on what the interests are. So see if what you're doing worked, if it didn't work, and how you can improve. Next slide, please. Now, to conclude, I want to mention that the volunteerism is our welcome, and it's very important into our programs. So we are very open to volunteers year round, whether you want to help in the garden, assist in activities, and share your skills. There is always a place for you to contribute. When you volunteer at a different organization also helps you to understand more about the community so you can come back to your own community or your own organization with a fresh air and fresh ideas of things you can be doing there and you can apply, or you can bring your own experiences when you're volunteering and you take to this organization that you're volunteering at so you can bring more ideas and enrich the conversation with them as well. So in this slide, you can see my email address and NHCOA's phone number. You contact me directly for more information in how to get involved. And, if you wanted to discuss ideas, if you wanted to see things we can do together too for the community. Um, Remember that engaging with Latino seniors isn't about filling calendars with activities. It's about building community and belonging. When we honor the culture, adapt to their needs, and create joyful moments, we will help them thrive physically, socially, and emotionally. Thank you for your time and for the work you do to support Latino older adults. I will be happy to answer my questions on the Q&A session at the end. Thank you.
Thank you, Pedro, for your presentation. So, in today's webinar, we have heard about the importance of promotoras, effective outreach strategies for rural populations, and likewise effective strategies for engaging Hispanics and Latinos in senior facilities. So now we will highlight the effective strategies for working with Latinos, specifically with the state of California. So our next speaker is Elizabeth Jimenez, who has been a passionate advocate of seniors in her community since beginning her work at the Mexican American Opportunity Foundation, or also known as MAOF, a nonprofit organization based in Los Angeles, California. So welcome, Ms. Jimenez. I think you're muted, Elizabeth.
Sorry.
No
Okay.
worries.
Good morning, everyone. I'm so happy and so delighted to be on this panel. It seems like we all in this together, so I'm very happy. I work with the Mexican American Opportunity Foundation, so I'm gonna try to talk to you a little bit about our mission. Next slide, please. The mission of the Mexican American Opportunity Foundation is to provide the socioeconomic betterment of the greater Latino community of California. This is to accomplish through programs in early childhood education, and family service, and job training, and the senior lifestyle development throughout the community served by MAOF. Even though we target and our main target is the Latino community, we open the door to everyone. I mean, we have so much diversity here in Los Angeles that we open to everybody to come for services here. But again, our mission is to target our low-income Latino community. Next slide, please. As everybody's been talking about the best way and strategies to target our Latino community, um, everybody has mentioned it, and I think I'm gonna start with this: is gaining their trust. I think the best practice when working with Latino older adult is gaining their trust. Gaining the trust of the senior is to get them to listen and to listen to them and they will open to you. Part of gaining their trust requires building a safe space for them and speaking their own language. Once trust is built, seniors will spread the word about your agency. And when I talk about gaining the trust, it's also staying connected with them, having having open communication with them to continue services. Once you start building that engagement and that trust with the seniors, you have to stay connected with them by doing follow-ups. So anytime that they have any problem, any issue, they know where to find you, they know where to go, or they know where to call you. Also, it's very important not to only stay connected with the seniors, but I think it's very important also to stay connected with the families you had the opportunity, and if the seniors have the extended family, so they know where their family members, their seniors, they come in to get help for any kind of problem that they may have. So staying connected is very important. And next slide, please. A lot of times we have a lot of services, so it's like governmental offices. The seniors, they only go there when they need any kind of services. Being a community services is very important for you to find those seniors, so that way you can provide the services that they need. You need to find where they are. You need to go to senior centers, senior building, churches, social security office, and hospitals. It's very important for us to go and find them. Once you find them, then you can start providing services to there, so they don't have to navigate a lot of these governmental offices by themselves. Next slide first. When we do presentations, or when you partner with somebody to do presentations, we have to educate ourselves to stay current to benefits programs before attempting to assist seniors clients. We have to be ready for them to answer any questions that they may have. Always have materials in their language that your clients speak. And when we're talking about materials and flyers, we have to prepare them in a language that they can understand. A lot of times we put the translation in a very high way that our seniors, even if they're in their own language, a lot of times they don't understand them. Be prepared to answer various questions and speak to multiple family members. Have bilingual staff who can effectively communicate with clients and provide translation services. I want to also talk about the healthcare partners. If you talk to working with seniors and working with a nonprofit organization, you have the opportunity to work with a lot of partners. And the partners uh, that we bring, and I think they're very important in the life of our seniors and caregivers, is the healthcare partners providers, as the same as promotoras. They play a very a role in the life of the seniors, and also the families, extended families. So because of this, they have to be prepared in a language that the seniors may understand. Dealing with the health is very hard, not only for the seniors but also for the families. So I commit, and I have a lot of respect for promotoras de salud and the healthcare providers, so that way they can come and talk to the seniors. Um, Next slide, please. Another best practice is to outreach is to message directly to the senior community you serve. You must address any common misconceptions and concerns and or concerns seniors have about benefits programs. A lot of seniors there they very they have fear, especially during these times, to go to governmental offices. That's why it's very important for us, community-based organizations, to have a partnership like the Social Security, uh, uh, um, DPSS office, anything, all the benefit, Medicare, Medicare, because a lot of the seniors they afraid to apply for these benefits because they think, or because the neighbor it was denied, they think that that's going to happen to them also. So they have all these myths that if they participate in some of these programs, they will they will take probably benefits from their children, or they will become like public charge, or they will reduce if they get, for example, if they apply for CalFresh, they may think that the benefit that they already have, the Social Security benefits, probably later they will be charged to them. So that's the reason that we need to advocate and explain to them that is in addition. All these other benefits are in addition to that they entitled to. Next slide, please. And building partnerships is vital for an outreach. Partnerships help spread your outreach message and are important in building trust. Partners can assist with referrals. Partnerships allow you to move visible in the community and expand your impact. Having a key contact person is crucial when establishing partnerships. I can tell you that over here in Los Angeles, we have the opportunity to have offices in different public offices. We have a person inside Social Security offices that can assist our seniors, especially our Spanish-speaking population. Social Security office, they don't assist you in completing any kind of forms or anything like that. So we have a person there, or they have our referral. So the Social Security as well as the Department of Social Services, they have us as a referral so they can send the people over here. So it's very important for us to have especially those kind of connections that the seniors are gonna be applying and sometime in their life. Next slide, please. So I want to thank you. I really want to thank you, the National Hispanic Council on Aging, for giving us this opportunity. Being over here in Los Angeles, a lot of times, we we have a lot of services over here, but like Dr. Cruz said, I mean, we have such a much diversity that it helps us to have partnership like you, and this is a very a great opportunity for us, for you to know how we target our Latino population or seniors, especially during these times that California is being hit very bad about what's going on in our lives right now.
Thank you, Elizabeth, for your presentation. And thank you once again to all the panelists who joined us today and who also provided these wonderful presentations. So we're now ready to begin with the question and answer session. Just to be timely with our session here with the question and answer, we have a few of them. So I will start with the first one from our audience, and anyone from the panelists can answer it. So the question is, what cultural values or traditions should organizations be aware of when engaging with Latino American communities?
Can you repeat the question again? I'm having
Yes,
difficulties.
no worries. Okay, what cultural values or traditions should organizations be aware of when engaging with Latino American communities?
I can try to take a step on that one. I think that there are some characteristics that are common to the majority of subgroup within the Hispanic or Latino communities. Um, Familiarismo, for example. So that means that in our families, our familia is first, especially the women who is kind of in charge of taking care of the home and their loved one. So they usually postpone the all well-being to take care of their family. While in the other hand, we might find machismo, which is that predominant type of behavior in some men that they in their mind they think that providing food and shelter is what is their main role is, and they are the authority for everything type of decision that has to be taken within the family. And also I think that in perception of health, for example, is another important aspect. um, we have the tendency to, for example, that's why we might be some resistance to screening, for example, because it's, no tengo que buscar lo que no estoy buscando de manera que no llegue a mí. I don't have to look for this, so I will not claim it. And so they delay screening practices because they don't want to know. Um, I can continue mentioning some others, but I would like to hear from my panelists what they may have to say.
Um, if I can go next, I can
Yep, go
also
ahead.
add to what Betsy was saying, to so we don't assume something for them. So when you're talking to all the Latinos, we cannot assume because of we are thought that way, that they will like this type of music or that will be their religion. We cannot just say, oh, we're gonna do a Catholic mass assuming that everybody's Catholic. If they might be Protestant, they might be something else. So we cannot put some type of music, assuming that they will love that, if maybe they're not from this region or country of the music that we're playing with. So
Friends,
I
I'm not
think the
in the
key here
panel.
is to always
Right now?
try to ask them, with
No, it's gonna finish
also care
15.
to not be too aggressive. So, for example, if you're asking where they're
Nico, you
from, we need to
picture.
sound in a way that we're not um, asking for another reason. Since we are living in the United States and we know that could be a sensitive question, we need to be sensitive to what they can also hear from us and be careful and understand. So then we can tailor the services based on that and not the other way around.
I will also like to add the importance of language being used. I'm coming from Puerto Rico, for example, and we have the tendency to express cariño to everybody without knowing them. So it's so common for us with mijo, mija, amor, when you are not my amor. My amor is my husband, but we call amor everybody. And we also have the tendency to shorten the names. Instead of Luis will be Luisito, Carmencita, those itas and itos, and then grandpa and grandma, abuela y abuelo. But in some other subgroups, that might be a sign of disrespect. So we have to be aware about those differences. Even the word negro, in Puerto Rico, is an expression of love. In the United States, it's the N word. You don't say that word unless you are from the Black community, and it all depends in what group of the Black community you're going to be using the word negro. But from where I am coming from, negro is an expression of love. I used to call my husband before coming to live here in the United States, negrito mío, and then I can use it anymore once I learned that it's the N word. What we're not using, he's not calling me negrita, I'm not calling her negro. So we have to be very careful in the language that we use.
I will just add to what Pedro and Betsy were saying. Really interesting. Also, the importance of involving the family. For Hispanic, La Familia is a strong uh, component of their daily life. For example, grandma is sick, and you took her to the emergency room. Somebody take her to the emergency room. Everybody goes to the emergency room to see how grandma is doing. So that's what Hispanic does. They participate in family. Also, religion is an important thing. Most of them can be Catholic, but you can find a way to find out what their religion, what they prefer. But they're all going to be some kind attached to religion. So those two parts of cultural values are very crucial.
I agree. And for example, Dr. Price, and you mentioned about family members. And for example, when an older adult, like a grandparent, goes to a healthcare provider appointment, they usually don't go alone. They usually have their caregiver, or in occasions, they have their family members who join them. And because,
Yeah.
again, family members are a key part of the decision making of the older adults, and the older adult trust their families when making those type of decisions. So that's something to also take in consideration. That family will be always present in most of Latino and Hispanic Americans as well. So I have another question from our audience, and it is, how do Latino Americans prefer to receive information? By digital channels, word of mouth? What do you can say that will be their preference based on your work experience?
Well, I think that depends on the level of assimilation and acculturation. That plays a pivotal role on how we can reach best Latinos, because it's a matter of generations, for example. There are generation differences when you want to reach them. But in general, I will say that we are a community of word of mouth. So mi comadre me lo dijo, si mi comadre me lo dijo, that must be good. And
Exactly.
so that comes from prescriptions to recipes to events to gangas on sales or whatever, to programas, to all of that. It's the word of mouth and also radio. I think that radio is still in some communities the way of knowing what's going on.
I agree.
Totally agree.
Yeah. Also, adding to that is we try to use easy language, fourth grade level always, nothing too hard to understand by reading, and also we do use a lot of visuals, a lot of images when we're doing a flyer. So because again, we need to understand where the community are at this point and need to understand that many people that were not born here but born in other countries when they came at so young age, they maybe didn't have the opportunity to get much studies even in the United States or back home, and that's the reality of many of the community members. And so they worked, they now retired, but they don't know how to read and write properly. So we also need to understand that, and that's why we put a lot of images so people can try to at least understand based on images what's happening, and then ask some people what's this say, what is this about, and then they can get engaged. But word of mouth, it's of course crucial in our community, and Facebook also works very well. Our communities are on Facebook, that's for sure. So when talking to older adults, it's very important to have a Facebook engagement because that's where the channel they use more, the social medias that is used more by our community.
And I would like to what you just said, Pedro. For example, here in the communities that I work, I serve here in Georgia. In laundromats, they have what is called the community bulletin boards. So you
Mhm.
can find there for daycare to rent a car, or finding a car, or renting an apartment, to programs and activities, whatever you're promoting or selling or asking for services, those bulletin boards will have that information. Especially in communities that is man dominated, migrant population, that there's no wife in the house. They're looking for that kind of community bulletin boards. And for older adults, I would think, and for many Latinos as well, is the churches. Right now, I'm integrating a lot of communication around what's going on in the community, what kind of services are available, how to reach, food banks, food pantries, and services, immunization and Zumba classes. I mean, all that kind of things that our community are looking for. Now there is a huge boom on exercises for older adults, which is, to me, it's wonderful that organizations are getting into that, and how they're using a combination of all of the things, from radio to word of mouth to flyers to community bulletin board to churches to community-based organizations, gas stations, and some, barber shops and stuff like that, to promote the services and the programs and initiatives that we're trying to market to reach Latinos or Hispanos.
I think like Pedro say, everything has we had to start with something fun a lot of times, like Zumba classes, exercises and all that. But I just wanna mention something. We have a lot of baby boomers right now, and it I mean it's completely another different of approach because they have more access to the technology. So I'm very interested in educating those younger seniors, that they can bring, believe it or not, and I think it's across the everybody. It's that our seniors are living more now. So we have seniors already in the 90s, late 80s, and they yes, learning right now technology. Yes, right now at this time of their age, they learning to to have a smartphone. So we had the opportunity that we distribute meals to almost 500 seniors every single day. So we have senior centers that they go and they have they eat on senior centers. So I spread word to mouth is very good if you provide good services.
I completely agree. So I have a final question before wrapping up the question and answer session. So the final question is, what characteristics make a messenger credible and relatable to Latino communities?
I'm
I
sorry,
can't
Christina, can
hear
you approach the mic?
you.
Yeah, I can repeat. No worries. So my question is, what characteristics make a messenger credible and relatable to Latino communities?
That's an interesting question. I think that Hattie touched some of that. I think that when you show the true commitment and the true heart, people relate to that. There are some communities that when I go the first time, since I am a completely stranger for that community, the issue of trust will be there. And but when I start finding who are the gatekeepers, and so I work with them so they can introduce me. So they are gatekeepers, but they're also gate openers. And so when they see that the commitment is there, that my heart is there, that I'm really there to help them, that I'm really there to know about their challenges, their values, and working together to see how we can overcome those challenges and barriers in the community. I think that that makes a whole lot of change and and that speak to the way you do your approach, how you increase awareness, how what is your approach, even from your body expression, the way you dress, the things that you're doing, how do you talk to them? 'Cause sometimes I have seen some people that I have been invited to do outreach, and it's this top down approach that our people does not appreciate at all, because it's like you know um, lever down us because we might not speak fluently English, or we may have to ask questions more than one time in order to understand. So then people, they don't have the patience, but I will say the love to be compassion and try to understand that we're coming from different areas and different stages. We are all going through different challenges, and all of that has to be taken into a whole package. But I will summarize saying that the best approach is showing the compassion, showing the respect, keeping the dignity of the people, and in showing that yes, indeed, you are there to help.
I agree. So, as you mentioned, the
Yeah.
love, commitment, and also learning a little bit more the community they want to work with, like finding out information, who they are, how to reach out to them, their language, their wordings, or their cultural values. It's a must when working not only with Latino but also with other diverse groups as well. Dr. Perez, and I think you wanted to mention something.
Yeah, I was just want to piggyback on what Betsy was saying. You need to show up. You need
Mhm.
to show up. You need to be present. Show compassion. It's like you're not going to ask somebody for on the first date. You're not going to ask them to give you a big dinner or something. So you need to show up a few times, and then you need to let them know that you participating with them, and then not just when you want to promote an event and you're going to comment with your flyer and invite. Hey, I'm going to do that fair next week. Can you come? No, you need to start coming up to their fair first or to their event first. And then after that, when they know, oh, this is Harry, oh, this is Betsy, oh, this is Pedro, this is Elizabeth. I know them. They're good people. So they participate with you. That's the way to do it. Show up.
I agree.
Yep, I
So,
know we are 40 seconds away to finalize. Just to wrap it up, and I think the key here is they want to feel heard. When they feel that you talking to them and you understanding what their needs are, and you are coming to this community to bring something good for them, and then just like Dr. Parazan say, you don't come just for an event or for a participation, but you actually come for a change. If they feel that, then you have the community, you have their trust, and of course that's not a work from one day to another. That's an ongoing process where we show up, you listen to them, and they feel that you're coming there to actually help, and their needs will be attended by you. These are the secret where you keep engaging and keep listening, and this will keep going a trust process.
I completely agree, Pedro. And Elizabeth, I don't know if you want to say something else.
I just wanted to say I agree with everybody, and showing the respect and and have the compassion too. I mean, have the compassion of everything that you do. It is the key word.
Yes, I agree. And I know there's something regarding this new government with the Make America Healthy Again. So I think at the end, it's all start with wellness and also with having that trust in the community, as you all mentioned, get to know each other and always be active and encouraging others to keep track of what's happening in our community, be confident, and at the end, being committed to working with Hispanic, Latinos, and others, diverse communities as well. So I know that we must wrap up, but at the end, I just want to provide some closing remarks to all of our audience. And once again, a big thank you to our sponsors, speakers, and attendees for joining us for today's virtual event. We encourage you all to follow us on our social media platforms, as you can find us on Facebook, X, Instagram by using at NHCOA for more information about upcoming events. And again, let's continue advocating for programs and resources to better support older adults and their caregivers. So until the next one, thank you. Gracias. Thank you, all the
Muchas
panelists.
gracias.
Thank
Muchas
you.
gracias.
See you,
Gracias. Bye bye.
everyone. Bye. Be well.